Blog Talk Radio. Welcome to Women Who Rock Investigate, an affiliate of Women Who Rock with Success. We report case studies in the areas of policy and government, medical malpractices, health pandemics, biotech and fracking, global climate change, prison, and police reform, and more. Our topics are covered around the latest breaking news reports in the U.S. and around the globe. We can be heard on Spotify, Google Play, Google Podcast, TuneIn, iTunes, Podbean, Airtime Pro, and SAM Broadcasting radio stations, and more. Our hand-picked experts on the show provide credible information from their fields of experience. Join us on Thursdays at 10 a.m. Central Standard Time as we discover the latest in news reports. Now join us live in the studio with our...
Okay, perfect.
Okay,
perfect.
Wonderful. So I've already done the introduction, and of course...
I heard the introduction. I could hear it.
Say what now?
I said I could hear the introduction, and I think maybe just you could not hear me. I thought it was a great opportunity, as I stated, to address on not only two sides of the same coin, to give a little bit of update on COVID and also discuss telehealth, telecare, and telemedicine.
Okay, great. So we want to you also to be able to do a little introduction about yourself, tell the audience about you and what it is that you do and the passion that actually what took you into medicine.
First of all, as always, thank you very much for the invitation and the platform and the opportunity to share some insight. You do an excellent job on just offering to your audience a wide variety of just robust insight on many topics, and I'm just glad to be a part of that lineup as well. For everyone that's listening, my name is Christopher Colbert, Dr. Christopher Colbert. I am the Assistant Professor of Emergency Medicine residency at the University of Illinois. I am very active in not only academics, but also in the aspect of different topics of social emergency medicine and in reference to public health, and specifically had interest in how we navigated COVID and how we are currently navigating COVID and providing insight on the best way for all of us to move forward as a society and community, but not only these concerns with medicine, but also moving forward with other aspects of medicine as well. And it just so happened in the last 2 years, at the forefront of this conversation is COVID. In addition to that, because of COVID, there has been the silver lining on COVID is that it has offered an opportunity for all of us in all aspects of not only just medicine, but any professional endeavor to think outside of the box. And with that comes telemedicine. Without the push from a pandemic, there's so many aspects of what we do today that 3 years ago, we would have never taken the time to invest in defining, redefining, and evolving. And that transitions from not only education, but professional work development interaction, and also in medicine as well.
Okay, great. So we're going to start with the coronavirus, or whatever type of virus it is. And we have been through so many phases with this pandemic that the people, of course, people don't want to talk about it, but we have to talk about it. We have to continue to discuss it. I was thinking about that the other day. I'm like, well, no one wants to hear anything about the pandemic. It's just like a person to come and shoot you with a gun if you start talking about the coronavirus. But after I had saw of how it is rising once again in Wuhan, China, it is coming up. I think Saturday they had an outbreak of like 3,000 cases in that particular area. So this has to continually be discussed so the individuals can be more aware. And there are some questions that I do have, Dr. Chris, and we perhaps maybe have shared that on, you're about the 8th time guest on Women Who Rock Investigates, and we appreciate your service as well. But, okay, so it's coming from China. Let me go ahead on and just ask it, okay? It's coming from China. It's coming from other different countries. Why does the number continue to rise so much in the minority communities, such as African Americans or Latinos? And it's coming from a different, a total different tribe, a total different background of culture, and yet and still the minorities are the major tribes here in America that is going through the pandemic more than anyone, according to the statistics.
Well, there's a couple of things. I think that, number one, you hit the nail on the head when you express the fatigue of everybody. And when I say everybody, that's physicians, that's parents, that's teachers, that's in reference to addressing the issue of COVID. And I think what's extremely important to recognize is that, number one, if you don't talk about it, it's not going to go away. By ignoring something doesn't mean that won't be a point of conversation. And I think it's just a matter of just keeping everyone. It's kind of like taxes. You cannot pay taxes if you want to, but someone eventually is going to bring that up to you.
Correct.
Someone eventually is going to knock at your door and put your letter in the mail and say, "Hey, remember this?" And again, I think it's extremely important to just be mindful, and because we've learned a lot. We've learned just a lot, not only just within medicine, but just in how people work and how ideas and policies made. And hopefully a common theme about this pandemic is how important it is to adapt to change, and how frustrating and how non-productive it is to fight change or to act as if it doesn't exist. So that being said, most viruses within the United States, viruses usually transition from east to west. It always is done like that. It's not just COVID. It's when there's a virus that's always been discussed. That is how viruses travel. I'm not an epidemiologist, meaning that someone who specializes in the actual disease and how it travels. However, as an emergency room physician, I can explain and give firsthand account that this is a usual thing for viruses. Specifically, as you communicated as well, viruses change, and viruses change on purpose, and that's how viruses are sustainable. That's why there's always a recommendation to get a new flu shot every year. That's why once you get a virus, you have a virus and have to take its course. And there's no antibiotic treatment for viruses. It's just antiviral medication. So right now the conversation is the BA.2, which is also considered the stealth Omicron, and that's the newer variant of COVID. And I can't highlight as much and how important it is for individuals to get the vaccine and booster. Because once you get the vaccine and booster, you put yourself in a whole different category of your body's response to a virus. And I hope that from Delta to Omicron to currently BA.2, this lets all of us know that a virus is a virus is a virus, and it continues to work in that aspect of how viruses develop. And our role for protection right now, the best role is the vaccine, because viruses are going to mutate, period. They're just going to mutate, and that is how viruses sustain themselves, because they're designed to stay alive as long as they possibly can. The best way to do that is to change. And so that goes into the category of what are we going to do now? The same thing we did with Omicron, the same thing we did with Delta, the same thing we do for the flu in 2019 and 2018. Just be mindful, everyone, to cover your mouth, to stay home when you're sick, and to get the vaccines that are recommended, and you will significantly decrease the negative effects of any virus that comes down the pipe.
Okay, that's fair enough. So here comes a couple more challenging questions, because one is that, of course, the latest breaking news that we all have heard in regards to the coronavirus. This is an article from Very Well Health, and it states that Pfizer and Moderna seek authorization of a fourth COVID-19 shot. Of course, everyone went out to get the booster shot because they felt that it would protect them over the first and second vaccination that Americans and perhaps maybe global individuals, refugees as well, had to be able to take. So why, in your perspective, your opinion as to why they are the CDC, and we're gonna get on that too. At first I said, well, people are tired of talking about COVID and whatever. I'm like, no, they're not, because things continue to come out from the CDC and Dr. Falls and the CDC president, and they continue to be a caboose, and so it has the people confused, and so people are saying, okay, just forget it. We're not going to take any more because it seems like no one has any direction or leadership as to where we should be going. So we're going to discuss that. We're going to put that on and I know you have to work as well, so we're going to try to wrap this up so we don't detain you from your profession. But the Pfizer and Moderna seek authorization. This is an article that is out on Very Well Health. That's the name of the article post, of a fourth COVID-19 shot. Why is the third one, the booster, is not compatible enough to be able to sustain everyone, in your opinion? This is an opinion.
So, no, I think that's a fair question, and it's also a question I receive every single shift that I work in the emergency room. And the answer is that there is noted that the vaccine or the booster that's provided, that there is a window where the immunity is not as robust as it is when you receive the initial dose, the second dose, and the booster. And I clearly understand the point of frustration. I also understand how everybody, when I say everybody, I include doctors, I include the people that work at the CDC, I include nurses, I include, we all would like a line we can draw in the sand and say, you only need one pill, you only need one vaccination, one booster, and that's fine. And I ask people to put in consideration the amazing minds that went together that initially in 2020, in 12 months, those minds put together a vaccine. That speaks to technology, that speaks to data, and that speaks to patient outcome. Without that vaccine, we would have had double and almost triple the amount of deaths in the United States. And the reason I'm stating that is to also lead to the point where it's a process, and identifying there are new medications for diabetes today, totally different than what it was 10 years ago. There are new medications for hypertension, totally different than 5 years ago. And we don't think twice about that, of saying, hey, before we were just taking glucophage. Now there's different medicine for diabetes and different options and different timelines. But we're so critical on specifically the vaccines. When if you look at how medicine has evolved, all medicine changes in time. And to just understand that it's the best interest and to keep one's immune system robust. At this point, the CDC has data that shows that after 3 months, the immunity wanes and winds down. And how does that affect you? How does that affect my family? Because what happens is 8 months after the booster, there just like this, there is a new variant that comes out, and then we go right back up to admissions in the hospital, to limited beds in the hospital, and to people returning back to the hospital with fevers, respiratory distress, and increasing deaths.
Okay. So do you feel that, in your opinion, that this is the reason why that there are so many shortages now in America due to the coronavirus? You have a lot of headline news now discussing about, doctors are quitting, nurses are quitting, people are walking away from their jobs, they're tired, they're exhausted, they don't have time to see their family, they don't have leisure time, they don't have time to go to church, they don't have time for activities, and then there is a huge ratio of individuals that are leaving leaving their profession. And this is just opinion. Do you feel that it is due to the exhaustion due to the pandemic?
No, I think that's a fair question, and I think that contributes to it. I think that there's just across the board at all occupations, people are taking a second look at what they're doing in life. It's not just physicians. It's people that are attorneys. It's people that work at Walmart. And so there's a mass resignation across the board. And working in a hospital is no less of that umbrella of individuals resigning from their jobs. But also there are added stresses. There's added stress, particularly in the medical field, of which I can say firsthand and I've seen. There's specific frustration within all hospital staff. And a lot of that has to do with the conversation of how the interaction between and the conversations with hospital staff. A lot of it, unfortunately, is that the public questions, and which rightfully I understand where it comes from, but you question medical data, research, and opinion until you're sick. And then when you're sick, you or your family member's sick. No one believes, as an example, no one believes in vaccinations until their mother's sick. And then they come to the emergency room and want to be seen first. They want to go to the front of the line. I don't understand why we can't go to the back of the ER right now where there's a 10-hour wait because we have COVID. But 2 weeks ago, you didn't believe in COVID. 2 days ago, you didn't believe in COVID and didn't get the vaccine. But now that your family member is sick, you come to the emergency room and you want to be seen first. And but here's the thing, and you're laughing, but it's so true. And
you absolutely true. That's the reason why I'm laughing.
You're not the only person that wants to be seen first now. You went from a non-believer to a believer just like that because your family member was sick. Not because it's been talked about on the news, not because everyone's like, oh, I'll just wait. And as soon as they get sick, I change my mind. And that is by definition just a point of just natural frustration. It's a natural frustration. So it's just not. I mean, of course, we all listen to the media, and we try to get an understanding from the media, and so it's just not coming from the medical field. It's all over, all different types of practices. Because I did just hear a lifelong time. I don't know. She's been there probably about 20 years or what have you as a journalist, but due to the COVID, it caused her to reconsider some, and so now she's changing her profession. And I think in the month of May that would be her last time, on the set, and she will be resigning. So that makes sense. I'll agree. Go ahead and finish. I'm sorry about that. Go ahead. No, I think that, but and to your point, you said it so eloquently. What people see on the media is a point of frustration for the media. I mean, for society, and I understand that 100%. I understand when patients say, "Well, why did the CDC say one thing on Wednesday, but this doctor said something on Thursday? Then the CDC said something on Friday." And even I ask that. Sometimes I think to myself, we should have had a meeting about this before person X decided to say this on TV without talking to person Y. And then there's person W who's talking about it, who, in my opinion, had no business talking about this in the first place. So, there's a lot of aspects of this. And you also have to put into context who people trust. Some people some people take advice from person A, and some people take insight from person B. Even if person C is the doctor, they feel that person A puts their best interest in mind. And so there's a lot that goes into it. And to be an individual who deals with who wants the best for public health, you just have to be a good listener. And it sounds very corny and very cliche, but you have to listen to your patients. You have to ask questions so that we can move forward from the same place. I always communicate to not only residents, but this was communicated to me, the best way to have an effect on someone's life is not to have a conversation about how smart you are and how you went to medical school and how you completed residency. The best way to affect is to be relatable, to say, hey, I'm a dad just like you're a dad. hey,
Right.
I'm concerned about COVID, and I have children that go to school just like you have children that go to school. The only difference is that I admit children that come to the hospital sick, and you don't see it from that lens. And that was a catalyst for me making sure that my children received vaccinations, because once Omicron hit, all of a sudden I'm admitting children, and I never did before. And that scared me, and that gave me concern, and that made me look at things a little bit differently. And it's my hope that my firsthand experience can provide insight for you to make a good call of judgment in reference to your family members as well.
Okay, great. That's fair enough. So I got a couple more questions, because I think that sometimes individuals try to identify or define the status of an individual as to how they are able to be able to make certain decisions when it comes to people's health and what they should be taking. So these are a couple more questions that I would like to ask, and to see if you did not mind sharing that with the audience. And of course, we're going to attach a disclaimer to this recording as well when we post it on the sites, to make sure that we protect ourselves, me and as well as your profession. So a lot of times individuals don't know the entire description of a person's title, as I stated before, as to why they have the permission to be able to make certain decisions. So tell us a little bit actually who Dr. Fauci actually is and who he works with.
So, which is a great question. So, Dr. Fauci has the position of, and has the experience and the understanding of infectious disease. Let me see here. So, Dr. Fauci is the Chief Medical Advisor for the President of the United States, number one. Coupled with that, Dr. Fauci is also, his role is in reference to public health, and that's kind of what we discussed a little bit earlier in reference to what your role is, how is that defined, and what do you do in that position. He is the director. He was appointed the director of, in fact, of the NIAID in 1984, and currently his role, let's see here, I want to say, I want to get this specific, because the man wears so many hats in reference to, let's see, I don't want to misquote what he does. And the reason I want to say this correctly is because I feel that he's given different. I'm going to the actual slide. He's given different. Whenever I hear him on the news, they discuss different positions that he has. So literally, I've had patients that come in and say, "Well, this is what he did." I'm like, "Nope, that's what he did in 1984. This is what he's doing now. Nope, this is what he's doing right now." So again, here it is. So Dr. Fauci is a physician. He's an immunologist, and he's the director of the National Institute of Health and Allergy and Infectious Disease, and he's the chief advisor for the President of the United States. The chief advisor, medical advisor, he went to Cornell University, and his role is to assess and provide insight in reference to public health concerns.
Go ahead.
And because there's a new director of the CDC, and so they'll say, "Well, he's the director of the CDC." No, he's not the director of the CDC. That is someone totally different. And I think that is the point where people have questions.
Confusion,
yeah, exactly.
Yes, and so with that, we're gonna get one more definition from you, Dr. Chris, and that's his job. Well, we're not going to say his job versus Dr. Lewinsky. So share a little bit about her and what she does, because I think that's where some of the conflict is coming in at with the Americans, and and I guess perhaps even with the global medical platform as a whole, simply
100%.
because of the fact there is some information that is put out through her, and then Dr. Fauci comes in and he either agrees with her or he deflates it or what have you. And so there was a lot of conflict with Dr. Fauci and the former president, President Trump, of course. And so it's just a lot of Americans, they kind of have gotten confused. They don't even know what the people's roles are. The media just shares, okay, here's the president of the CDC. And sometimes people want to be able to learn as to what type of power they have to be able to give this type of information to Americans so Americans can be able to decide. I mean, they have already released all of the free COVID testings for Americans at home, which I thought that was a very good strategy. Not for sure how, and perhaps maybe we can get into that too after we talk about that, as to how the effectiveness of that is as well. So first, before we do that, we're going to talk about Rochelle P. Walensky. What is her role in America, and what is her role in the CDC?
So now, Dr. Walensky, her role is the chair of the CDC. Okay. That is her role. And she is the chair of the Center of Disease, and her role is to take this information and to provide insight to the United States, update of any of not only provide insight on things to be concerned with, but also to provide insight on wellness, ensuring that the public safety of the United States is at the forefront of conversation, as well as any evolution of change. And that's why she gets a whole lot of conversation, and that's in reference to the criticism. It's because she is right now the individual that's having to make the statements, okay, now we need a different booster. Here's the new data on removing the mask, because I would have patients coming all the time. Well, if Fauci's saying this, and who is this new person? Who is Dr. Walensky in reference to saying now we can take the mask off? Because Fauci said we're supposed to keep them on, but now her conversation is we can take them off, which I understand where that comes from. And they'll say, well, he was working with Trump, and when he was working with Trump, he said we have to wear the mask, and now that we have a different president, there's a new doctor who's in charge of the CDC now, and so there's a lot of definitions, different roles around the same conversation. And the best analogy I can give to my patients is when you're thinking of a football game, you have people on the same team, but a quarterback is throwing the ball to a wide receiver or handing the ball to a running back. They're on the same team, but they have different positions. And they'll talk about the exact same game, but from a different lens.
Okay, that makes sense, because we kind of want to be able to give the information out there to the listeners so they can be able to know exactly what type of position these individuals hold and what authority they have to be able to put out information. There are a lot of Dr. Chris. There are a lot of court cases where judges are having to make decisions based off of what she is putting out there for Americans. And so right now, the crisis is in the school systems. It's in the school systems whether the children can wear the mask and whether they cannot wear the mask. And so I just wanted to be able to kind of put that in there for you to share that with the listeners and the audience as to what their roles are and what to expect from both of these leaders. And so the next question, we haven't even gotten into the telemedicine yet. It's almost, our time is almost up. But the next question is, okay, so you know that everyone that have submitted their information in order to get a free home package of the testing for the virus and what have you. In your perspective, how effective has that been for even some of your patients?
It's huge. It's huge because it's a resource for a better understanding. I encourage everyone, if you have the ability to have at your home a test for COVID, to keep it, and to use it to use it sparingly, but just have it. It's always better to have and not need than to need and not have. Think of having that resource as having a thermometer at home or having Tylenol or Motrin for fevers or body aches. You keep Tylenol in your home if you need it, and it's a great resource whenever you need it, but you don't want to have to leave your house at 2 o'clock in the morning because you think you have a fever because you don't have Tylenol in your home. And with that, Tylenol can decrease a lot of those symptoms such as a headache and a fever, and having the resource of those COVID tests at your home can give you peace of mind. It can give you insight as well. Are these symptoms related to COVID? Am I COVID positive? What can I do with this information once I identify that I am COVID positive? And I would like to say this as well. And again, thank you so much for bringing this point up. Remember, before COVID, you weren't supposed to go to work anyway with flu-like symptoms.
Correct.
You weren't supposed to go to work. And people seem to forget that. They're like, oh, I got the flu. I can go to work. Oh, no, you can't go to work with the flu. Correct. You couldn't go to work. That's, before 2020, you couldn't go to work anyway with the fever and a cough. They recommended, we recommended that you stay home. And I would say this beforehand, when you were a child, your grandparents knew exactly what to tell you what to do when it came to being sick. Cover your mouth when you sneeze. Stay away from your uncles, your nieces, your nephews, your aunties. If you have a fever and you have a sneeze, just wait till you feel better. And if there's any way you can have, and if there's any way you can decrease these symptoms, for us it's vaccines in this capacity, but everyone has family members that have some sort of remedy, or whether it's hot toddy, whatever it was, to decrease those symptoms. That was a part of conversation, and no one questioned that. No one ever questioned that. There was no data that my parents gave me on a hot toddy. They said, this is what was given to me, this is going to decrease your symptoms, and it usually worked. I didn't question my parents. I didn't question my grandma. It just worked out. Now, once I went to medical school, I said, I don't know if this hot toddy was medically approved or FDA approved, but it worked at the time.
It did the trick, right? Absolutely,
yeah, it did the trick.
Absolutely. So thank you for responding to that. So the next question, Dr. Chris, is from where you are in the city or the state of Illinois and in the city of Chicago. So what are you seeing versus the decrease and increase of the individuals coming in through the ER with the pandemic or what have you? Because I know that they stated that, well, it's gonna may have to be like a annual type of shot or immunization that Americans will have to take, or perhaps maybe people all over the world is going to have to take, just like the flu shot and what have you. So have you seen a decline or an increase in regards to the COVID in your location?
Well, just like many ERs across the United States, keeping our fingers crossed, we've seen a significant decline. Like it's night and day. Where we are in March of 2022 is night and day from November of 2021. Night and day. Okay. And I attribute that to a couple of things. Number one, there's greater conversation. More people were exposed to Omicron as well. There's a significant amount of people that have vaccines. Just in the past 4 months, if you look at the population, how many people did not receive the vaccine just in November versus how many people have received the vaccine in March of 2020, from November of 2022, it's night and day. And wow. I'm very happy that, it's night and day. It's night and day. Okay. And I have not admitted a patient with COVID, I would say almost in 2 weeks. And I'm maybe a little over 2 weeks. Yep. Okay. And I've seen patients that were positive but not had to admit them to the hospital. And I give a huge thank you to everyone out there who received the vaccine, because it makes a difference. And
that's fair enough.
Yeah.
Okay, that's great. That's fair enough. I know we done kind of perhaps maybe toggled your brain this morning in regards to COVID-19, like we do always ever since. I think you've been coming on the show ever since 2020.
2020, yeah.
Ever since 2020. So we appreciate you. I promise you we do. So we're going to get into telemedicine right quick, Dr. Copeland. Again, we thank you so much for your expertise on sharing with us. And so explain to the audience a little bit about telemedicine.
So, ladies and gentlemen, again, there are a lot of aspects from the pandemic that we can look back and say, this was the catalyst for us to think outside of the box and offer patients, specifically with reference to medicine, offer patients a different opportunity to see a physician. And one of them is telemedicine, because once there was the huge numbers of the pandemic, both doctors and patients wanted to remain safe as possible. I remember when it was really in early 2021, where if you're waiting 8 hours in that lobby, you're going to end up positive for COVID. I remember thinking, I was like, this is not the place. Yeah, if you're going to wait 8 hours, and we were back and we had no places, we had literally no beds, I would just tell people, look, this is not the place to come. If you have the sniffles, call your doctor. Don't sit in our lobby to get COVID and for negative outcomes to take place. And that being said, the resource of telemedicine. Now, telemedicine is by definition different organizations that are providing virtual appointments and expanding health options. And there's different aspects. There's telehealth, there's telecare, and there's telemedicine. Now, telehealth is your access to educational services or remote monitoring. Let's just say, hypothetically, you're concerned that your heart is beating fast, or you have what's called palpitations, or you need what's called a Holter monitor. And so that allows individuals of medical insight to monitor what you're doing and how your heart is beating at home. That's under the umbrella of telehealth. Now, telecare, as it relates to technology, is more like mobile monitoring devices as well. Now, telemedicine is your access. You can have an appointment with a physician, and you're having a conversation on Zoom or Skype or whatever platform that is used. And we've seen significant benefit with telehealth. To give some insight, number one is convenience. It's easier to follow up on regular. It's easier to follow up with regular checkups with your primary care physician. Hypothetically, let's just say post-surgery, you have seen orthopedic physician, and for an elective, let's just say hip or something. And so this is your third visit after surgery. You can see your physician and ask and engage and have substantial questions that can be answered. And if based on that conversation, the physician or nurse practitioner feels you need further insight and hands-on, then that's the next direction that goes. There's nothing better than face-to-face contact with anyone providing health care. However, to accommodate a growing demand and to also accommodate convenience, comfort, and significantly decrease the possibility of spreading a virus in any capacity, telemedicine fits that need. And coupled with that, also with telemedicine, it's easier for a patient to engage and have a conversation with their physician and have family members there as well. Let's just say your partner in some capacity knows a little bit more about your health than you do, and that is, as an ER physician speaking to patients, I would say 80% of my married couples that are married for 10 and 20 years, the wife always knows everyone's medical history. The husband will look at me and say, I'm not taking any medicine. I'm like, there's absolutely no way you are 70 years old not taking any medicine. And she'll turn around and she's like, you know what? He had heart surgery 3 years ago in 2007. He had so-and-so. He takes this, pop, 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 pop. And without that wife at the bedside or that partner at the bedside, you would have looked me dead in the face and said, nothing's wrong with me. I'm just here for a regular checkup. And that it's insightful. It adds value to the conversation, and it gives content as well. And also, it's a realistic evaluation. Sir, how are you doing? I'm doing well. No, he's not. He wakes up in the morning and says he can't get out of bed because the joints are bad. Sir, is that true? Well, yeah, you're right. Sometimes we got to be, okay, well, which joint is it? It's my elbow. Okay, all right, thank you. Had your wife not been here, you would have walked right out of this room and said, I'm okay.
Mm-hmm.
So and so that there's an aspect of telemedicine where it allows for the opportunity for your loved ones to contribute, if you want them to your actual conversation. And so just another opportunity for patient interaction that provides convenience, safety, and also assistance to patients.
Okay. Wow. And you just said something on the tail end of your comment, and so perhaps maybe we're going to have to get you back in here, so we'll be talking about that real soon too. That just kind of a light bulb just went off, because a lot of times, we have to have the HIPAA practices, and so HIPAA, even if it's the husband and they live in the same house, so the couple, they will not give out information from the physician's office, the hospital, neither of those. Even if they live in the same home and they are married, they will not give out any information. So I feel that the telehealth is going to be a trend that is going to be growing. Sometimes you have to pull teeth and nails. I'm like, wait a minute, I'm serious. I had to roll up my sleeves one time talking to this nurse. I'm like, this man lives in the house with me. If something goes down with him, I'm coming down. I'm going to get you. Okay, I did. I had to roll my sleeves up over the phone, and so I think that is very, very important. So I think that's going to be our next discussion. We're going to be talking about, and we're going to toggle your brain once again, and perhaps maybe a few more weeks or a few more days in regards to that, about wills, HIPAA laws, and advanced directives. I think people don't understand, and as you stated, sometimes we people, all of us, we get to the last drop in the bucket. Oh, I want to go first, but at first, the person was saying, well, I don't believe in that, and of course they're still saying it now. Or it's the media just boosting it up. There's no such thing as the coronavirus and things. It's just something that the legislation is bringing, to try to make everybody go to the doctor and do this and what have you. And so some people they don't understand the concept of it until it comes to their house. When it comes and knocks on their door, now all of a sudden they want everybody to put all the other patients outside in the garbage bin, and they go first.
Well, and you know what? Again, I think that you just do such an amazing resource of providing an opportunity to expand the conversation on so many aspects of medicine, and give an opportunity for your listeners to engage in conversation and also to learn. I think that a great opportunity for conversation is just what you said. You would be surprised at how many family members come to the hospital, mine included. I'm not different than anyone else. And decisions on wills, DNRs, what you want done in certain situations are not documented but communicated. And in a hospital setting, communicated doesn't have any weight as documentation, because as sure as my name is Dr. Colbert, I will have an aunt that comes in and says, Bill didn't want this. And then 2 seconds later, I've got Bill's sister that says, yes, he did. And then I've got Bill's wife that comes in and said, well, he told me he wanted something different on Thursday. And in a matter of, and specifically with African Americans, Black and brown communities, we don't write nothing down.
No.
We don't write anything down. We don't write anything down, or we'll just tell one person in the family what we want done. And then someone will come to the emergency room and say, well, you know what, or just like something simple like you need blood. Something simple like you need blood. And I'm not saying life or death. Let's just say you have a history of fibroids and there's a conversation on blood. Well, I don't feel comfortable making this decision. My spouse should make the decision. Your spouse isn't available, so then you call your uncle. And this is true life situations. You call your uncle, and then your uncle comes in and says, "Oh yeah, well we said we're not going to do this." And then the wife comes in, and then it's a whole different thing. Wait, what y'all doing up in here? Like, write your stuff down. I can't tell you. And this is what I tell my own family. Like there are certain conversations we need to have as adults. There are certain conversations you need to have as a partner. There are certain conversations you need to have as a family member. And I think that sometimes, specifically with Black families, we shy away from these conversations. We feel that these are adult conversations, or I'll just wait till it happens. And when it happens, it's too late to make that decision, or you don't have the opportunity to think. You don't have the opportunity to make to sit back and say with a peace of mind and make a decision. And it really takes 2 seconds to have those conversations. And as you it's so well introduced, that's something. If there's a list of things, maybe that could be the next time I come in. These are things you should talk to your family about. You would be surprised at how many families don't say, and it has a huge effect. Do you know that your aunt had breast cancer, and her sister had breast cancer, and our grandmother had breast cancer? So you need to be checked for breast cancer at a younger age, because by the time you identify it, you have a higher incidence of having negative effects from breast cancer at a younger age just because of family history. Diabetes, breast cancer, colon cancer, there are just higher, there's just unprecedented numbers of deaths within underrepresented minorities just because we don't have the conversation with our family to get early checkups.
And that comes from the early family ancestors as well. You know, back in my day when I was coming up in the 60s and early 70s, you know, you got up, you ate, you went to church and what have you. People didn't sit down and discuss. Even if they had something going on with them, they're not going to tell you. They're not going to tell the child. They just kept a closed mouth. They fought it the best way that they could. They figured that if the quieter they become, that will take the ease or the stress off the family. But that's the worst thing of it, because it devastates the family in the end, because they're trying to scramble how to get these pieces together. And then, you know, you had the physician come in. Well, we didn't know that we could have went in with another procedure and what have you, instead of doing surgery. Well, he's dead now. And so in my situation, this has been about 30 years ago, so the family didn't want to pursue the doctor simply because of the fact that they, you know, of course, had to get funds up to pay the attorney, but the doctor went in there and made the wrong decision. That's because the grandfather did not go in there and sit down and have a discussion as to what his issue was going on within his body. And so that's what we really need to be talking about, and that's what we want to love for you to come back on the show and discuss about the HIPAA laws. We want to talk about the advanced directives, the importance of that, simply because I was in a situation. So let me tell my story right quick, and then we'll be ready to get off this show. And so
Go right ahead.
The doctor was not willing to do anything. He had to find the spouse first. He had to find my husband, and so my husband was trying to find a way, because I went in and went to another carrier, for a medical carrier, you know, in another town that was like an hour away. And so it was just back and forth. And so I think that is kind of professional on the doctor's behalf, but I feel, too, that it's just some things that could have went just a little bit better. But I do understand his reasoning as to why he did it. It was like, no, we can't go back here until we get someone contacted for you, because it was a situation that came up at the last minute, and I was not expecting it, and I had to go into immediate surgery. And so with that being said, I mean, you know, and I do believe that protects the physician as well, his reputation. It protects his practice as well. And that's just some things we're going to be discussing, too, on the next time which is probably going to be next week if you have the availability. We're going to get you back on here for that, because I try to talk to also another audience real briefly, and so I try to help them to understand that, too, for those that have loved ones that are incarcerated. We've had attorneys on the show back here about 3 or 4 months ago, and so they were telling the prisoners and their families as the importance of having these advanced directives, because once they go behind the bars, and the prisoner says, "Oh, I don't have any one that's seeing no power of attorney." Oh, okay, so now you've left the answers and the decisions up to the prison institution to be able to make those decisions, because there's no one in place to make it. So we want to get down into that, and so I'm going to try to schedule the next show with you, Dr. Chris, as early as possible before your practice begins at the hospital. So we can get into some more. Yeah, so we can. And we may do video next time. We may do video. We may do video. This way, that will help them a little bit better to be able to understand. And all I have to do is just take the video and post it and say, here, there it goes. I just told you so. Okay, you've got to have a power of attorney before you can be able to make medical decisions. And so I think that will keep people out of court with tort claims and things like that, and that will be able to help them to understand a little bit better. So with the last question, Dr. Chris, would you please share with the listeners how they can be able to find you, any publications that you have written and published? You can be able to share that, your website where they can find you, and how they can be able to connect with you on social media platforms.
Wow. Again, thank you very much for the opportunity to expand the conversation on medical health. And it's my hope, everyone, that this conversation helps in some capacity. It adds a little bit of insight, plus minus in whatever direction, just so that it provides insight so that you can make informed decisions. I really appreciate the invitation and the opportunity to share and hopefully provide insight. My Instagram is drchris.er. So this is a means of just gaining insight. I always make comments each month. There's always a day dedicated to some health in some capacity. As an example, yesterday was National Diabetes Day and Diabetes Awareness Day, and I provide insight in reference to medicine and how we can all work in a better direction for health. And also, I feel I like to be relatable. I feel that's the best way to connect with patients, is to say, hey, I get it. Yep, I went to medical school, but I'm also a dad. I'm also a husband. I also have children that go to school. I also am a coach for my children's soccer team and basketball team and all that kind of good stuff. And the same questions that all of you have, I've got the same questions as well. But I just have the ability to kind of do a little bit of reading and understand it myself. And the same family members that you guys have, I got the same family members too. We could talk about that as well. But in the immediate future, we have a couple of medical conferences. I'm the chair of certain medical communities and societies. I'm having lectures. I'm giving lectures on transplants. That's a whole different conversation as well, and how there's disproportion of organ procurement with Black and brown patients. We could talk about that later as well. But everyone stay healthy. Please use robust resources. Robust resources when you're looking for your medical insight, and speak to your doctor. Speak to your doctor, speak to your friends in reference to health. Today's the first day of the rest of your health, and a little bit of insight on public health goes a long, long way.
Absolutely. So we thank you so much for taking the opportunity on your end of your profession to be able to share these resources, tools, and information with the audience. And audience, of course, we got another segment that's coming up at 10 o'clock, so just follow us right on back over there to that session with Women Who Rock with Success. So once again, Dr. Chris, we thank you so much, and we'll be talking or speaking with you in another week or so, okay?
Okay, sounds good. Thank you very much. Everyone have a wonderful day.
Thank you for tuning in to Women Who Rock Investigates, where we uncover the latest and viewers. Some of our media content may be sensitive to our audiences. Viewer discretion is advised.